Hi, it's Dr. N. We're back today and we're talking now about gut health and talking about the 4R protocol, which is the general approach that we apply in trying to fix gut issues. Now, if you remember from our last session, we talked about the general structure and organization of the GI system. And we talked about different places where things can go wrong, different types of problems that you can have with the gut. What can promote those things, and some of the things that happen as a consequence of having a bad gut. So today we're going to turn our mind towards the framework for fixing those problems. Now on the screen there you see the 4 different R's: remove, replace, replenish, and repair. And this is really descriptive of the 4 main categories of things that need to be dealt with in fixing gut problems. And the truth is that not everybody is going to need each of these 4 R's. Somebody for example, may have good digestive capacity, and so they don't need to have the replace element, which is typically supporting digestive function. So for some people, it might be 3 R's, or maybe it's even 2 R's. But the point is that this approach has been around for a very long time, for quite a bit longer than I've been in practice, which is right at 20 years now. And over the years, it has changed, and it's practiced different ways by different people. So this is just the concept. This is the model, if you will, of how to approach fixing gut problems. So let's talk about each of these in turn, just to make sure that we have at least a framework and understanding. And then, of course, in our one-on-one sessions and setting up your protocol, we'll be able to determine whether or not we need to do a 4R protocol or a 3R protocol, or whether we do all of these at the same time or do them somewhat sequentially, because there's any number of different variations depending on each individual circumstance. Now, the first core is about removing critters. It's getting rid of things that aren't supposed to be there. And as a general rule, there are 2 types of infections that you can get in your gut. One would be pathogens. Those are things that should never, ever be there. And the easiest example, I may have used this in some other lessons, would be things like, say, salmonella or some kind of food poisoning. Acute gastroenteritis from a virus. We should never really have those things. Now, in reality, even in a healthy gut, there are some pathogens, but they're in such low populations, they don't have a chance to populate or grow, that they never really gain hold. And if you remember back about some of our other lessons talking about the gut and the immune system, as long as you've got good acidification in the stomach, you can sterilize things coming in. And as long as your gut mucosal system is working well, you tend to have good immune responses. And so you can handle the things that are always trying to get inside you to infect you. But going back to the slide here, there are pathogens, and then there are what are called commensal infections. Now, commensals are things that are actually normally present in the healthy gut, but they're very low populations. And these commensals are typically neutral, meaning they usually don't help us, not like probiotics, which are good bacteria that do good things for us, but they also don't hurt us as long as they're in low quantities and low populations. So we can get infected again one of 2 different ways. We can catch something we should never have, or we can have an overgrowth or lose control of something that is typically in the gut in low populations, but is otherwise considered neutral. But when it increases in population, it can shift the balance of what's going on in the gut environment and create issues. Now, either way, we need to control that. We either need to get rid of something and completely evict them from the gut environment, or we need to pare them back or to control the population so that if it's a commensal overgrowth, we end up going back to that original state, which is, we've got some of these things here, but they're in such low populations they don't make any difference to us. I want to talk just a little bit about the difference between the conventional and the alternative approaches here, because certainly a lot of people are being treated for either known or suspected gut infections. And anytime you start talking about, hey, I've got a fungal infection, I've got candida, I've got a parasite, a lot of times the question comes up like, should I take an antibiotic or should I take an antifungal medication? And that certainly can be beneficial in some cases. And I'm not entirely against it, although it's certainly not my first option. I would almost always prefer to manage these situations just through a natural methodology. Now, the advantage of using different types of conventional medications would be they typically work a lot faster than the natural approach does. But think about it this way. On one level, all you're doing when you're using a conventional medication to get rid of critters is you're killing the critters. You're not doing anything to support enzyme function. You're not doing anything to replenish healthy bacteria. You're not doing anything to repair intestinal permeability or leaky gut or an inflammatory process. And so it's extremely one-dimensional, and it has a whole bunch of downsides. And one of those would be that certainly at least antibiotics, and there is some discussion about whether or not these other types of medications like antifungals or antiparasitics kill off the good bacteria. But let's just make an assumption that if you're going to go in with a high-powered antimicrobial, right, something that kills critters, these medications aren't necessarily intelligent enough to distinguish between the good guys and the bad guys. Now, the truth is, even some of the herbal things that we use have an impact on the gut, the good, healthy bacterial population. But the research does suggest right now that herbal type antimicrobials don't have the same devastating effect on the good bacteria as these pharmaceutical drugs do. One of the other things that's important to know about trying to use a medication to kill a critter is that these different types of medications, they don't have what we call broad spectrum applications across types of critters. Now, you may have a broad spectrum antibiotic, but that only kills multiple species of bacteria because antibiotics are not effective against fungal infections, and antifungals are not effective against antiparasitic infections, etc. So if you're dealing with using a conventional medication to try to kill critters in the gut, you really kind of need to know exactly what you're dealing with so that you can pick the right kind of medication. There's no point taking an antibiotic for a viral infection. There's no point taking an antiparasitic for a bacterial infection because it's just not going to work. These drugs are designed to do very specific things that happen only within certain types of critters. And the other thing that's associated with the choice of these medications is that even within one critter type, let's say we're talking about bacterial infections, certain specific medications may not impact specific species within that genre. So there are certain antibiotics that just don't work with certain types of bacterial infections. And so you either have to have the specific medication or you have to have something that is so broad spectrum it's going to kill all kinds of bacteria. And in that case, you're really going to devastate the normal gut ecology. In fact, the more broad spectrum a medication is, the more you have to pay a lot of attention to going back and remediating the gut environment because these broad spectrum medications really do devastate the gut. Now, the other issue on the downside with these medications is that routine use causes resistance. And I think most of us are aware these days of the concept of antibiotic resistant strains of bacteria. But we're also seeing, and you can go to the CDC or the World Health Organization and see these reports, but we're also seeing antifungal resistance. We're seeing antiparasitic and even antiviral resistant. So the more you use these things and the more broad spectrum the application, the more likely it is that the critters you're trying to kill over time develop a resistance to that. So on one hand, there is an advantage to using the pharmaceuticals, and that typically is a quick hit. But it's an incomplete effort in controlling the gut environment, and there are a whole bunch of potential downsides. Now, on the alternative side, instead of thinking along the lines of, hey, we need to pick the right medication for the right type of critter, and even the right medication for the right species of that type of critter, when you start looking at the herbs that are commonly used to kill critters, these antimicrobial words, and the word antimicrobial encompasses fungal infections, bacterial, parasites, and viruses. These antimicrobial compounds are broad spectrum and they're multi-species. And what that means is I may be able to pick a compound or a couple of compounds that exert not just antibacterial activity, but antifungal as well. And in fact, most of the things that we tend to use in practice do display this broad spectrum application, but for some reason, and I don't know that science really understands this, we don't tend to see resistance problems. Yes, there are some specific resistant issues with certain species affecting certain kinds of bacteria, etc. But the strategy typically from a natural standpoint is to use not one, but multiple broad spectrum compounds, which increases the probability that with your choices, you're going to kill as many different types of critters that you can kill. Now, again, I said just a moment ago that research does suggest that natural antimicrobials are less damaging to the gut flora. I don't think that we can say that if you use an herb instead of an antibiotic that you're not going to kill off healthy bacteria. I think you will. But again, the research is suggesting it's just not as much of a problem. Doesn't mean that we don't have to pay attention to restoring the gut flora or the healthy probiotics. But also, as we were just saying, that not all critters are susceptible to the same natural agents. And so even though we would prefer to use herbs, we still have to follow this broad spectrum concept, right? Picking things that actually have the best application to multiple different types of species. Now, having said that, here's just an example of some of the things that I like to use in practice. And in fact, and these are from different formulas that we use from trusted sources, of course. And it's not unusual for us to use 2 or 3 different formulas that may contain the vast majority of all of these things working together. So, for example, in the world of natural medicine, things like berberine, golden seal, and oregano are generally considered antibacterial, right? Your natural antibiotics. But each of these compounds are also effective against fungal species, parasites, and viruses. And the same could be said, for example, wormwood, black walnut hulls, grapefruit seed extract. And the use of either one of these is really dependent on whether or not we have test results from a lab that says that, hey, whatever you have in your system is susceptible to this particular compound, or whether we don't have the benefit of that kind of feedback from a lab test, and we're just trying to make sure that we cover as many bases as we can using 1 or 2 of these, or using several of these in combination, and even employing strategies like using one for a while and then switching it out so you don't get some kind of a resistance, really ends up being very, very effective in the long run. Now, in terms of time frame, when we're talking about killing critters, there's a general consensus that it's going to take anywhere from 8 to 16 weeks. And that seems like a pretty broad time frame. But when you're talking about killing critters and doing it within the context of rebuilding the gut, and not just killing things off and leaving the gut still devastated, 8 to 16 weeks is really not all that bad. But how do we know where someone is going to end up? Like, how do I know with one person it's going to take 8 weeks and another one's going to take 16? And the answer is I don't. And could it take somebody 20 weeks instead of 16? Of course it can. These are just generalizations. But I will tell you that years ago, when I was doing a lot of testing, I still do a lot of GI testing, but back when I first started doing this kind of work, I diligently did pre-testing and post-testing with every single client that we worked with. And what I found was that when we did find problems in the gut where we had infections and had to get rid of critters using these types of compounds that you see on the screen, we routinely did a 12-week protocol and we retested on the 9th week. And I would say well over 80% of the clients that we retested at week 9 had no more critters in their stool samples. Now that gives us a general expectation that it's going to take at least 8 weeks to kill things off. But again, depending on individual circumstances, it may take a little bit longer. Now, one of the things that really extends the time frame is whether or not somebody has a particular type of gut infection called SIBO. And SIBO stands for small intestinal bacterial overgrowth, and we'll have a separate lesson on that one just to kind of flesh out the details, or at least the big picture in more detail. But people who have SIBO, those things tend to be a little bit more difficult to get rid of. And so that tends to go more towards the 16-week issue. Now, at this point, you probably know that you either have SIBO, or we've agreed that you either don't have it or that you do, or it's likely that you do. So there shouldn't be any confusion about that. But I just want you to keep in mind that it may take 8 to 16 weeks to get rid of critters. And it's not unusual for us to recommend that maybe a few months after we complete a gut protocol, we actually go back and kind of drop a bomb in there again, right? Use some of these compounds for a shorter period of time, maybe 3 to 4 weeks, to go back and just to get any stragglers or any residuals that may have the potential to regrow and reestablish the infection. But nevertheless, the natural strategy is to use multiple broad-spectrum herbal compounds that have less of an impact on the gut flora, but still, with time and adequate dosing and consistency, still have a very high potential to control and get rid of the infections that we're wanting to deal with. And again, the time frame is anywhere from 8 to 16 weeks, so we have to commit at least a 2-month period of time to that. Now, there's another aspect of the remove which is not really specific to the critters themselves. There's something called biofilm, and this has been kind of a hot topic out on the internet in certain circles. Biofilm has been in the research, in the medical research, for well over a decade. But basically what biofilm is it's a gooey matrix that critters secrete to encase themselves in a protective layer that really protects them from things like antibiotics or any other kind of medication, as well as herbs, right? There's no magical element of an herbal compound that's going to allow it to penetrate a biofilm and get to the critter to kill it. And so we have to deal with biofilm in almost every case. The research is suggesting that about 80% of all infections in the gut, and it doesn't have to be in the gut, we actually see biofilms showing up in, for example, hip replacements. Like that was, I think, where some of the original research came from, was that people have hip implants or hip replacement surgery. If you get an infection in there, they tend to form biofilm around the actual orthotic or the hip replacement itself. But nevertheless, most organisms of any kind, especially with bacteria and fungal species, even some parasites, secrete this gooey matrix. And what it does is it just decreases the effectiveness of even a well-chosen medication or a well-chosen herbal compound. Now, there is a concept out there called biofilm busting, right? So busting biofilm increases the effectiveness of any protocol you're using, because it simply opens up the critters to invasion, right? It just makes them available to the medication or to the herbal compounds to get them to inhibit their growth or to directly kill them. And there's a couple of different ways to do it. Some companies make special enzyme blends. There's certain enzymes, when you take them on an empty stomach, because if you take them with food, then you just end up using them in the digestive process. But if you use these certain enzymes on an empty stomach, at least part of those enzymes are going to start to degrade any biofilm that's there. However, many herbs that we use to kill the critters actually dissolve the biofilm as well. So they kill critters and they dissolve the biofilm. So sometimes we use the enzyme formulations, sometimes we don't. And I don't want to create any confusion if I say, hey, we use enzymes to dissolve biofilm. We're not using these special enzymes for you. It's because the protocol we put together for you includes compounds like berberine or grapefruit seed extract or any of number of the other ones that actually do both of these things, right? Kill critters and dissolve biofilm. But I want to bring this up here because it is part of an effective protocol in most cases. But if you're doing any research on your own or have done this on your own, you're probably coming across the idea of biofilm. And I don't want to leave that as an empty space, so to speak, where you're aware of it, but we don't have any conversations. Now, the second element of the 4R protocol is called replace. And this relates back to replacing lost digestive capacity. And if you remember back to the lecture on the gut, we talked about the brain-gut axis, we talked about the thyroid as being the two things that have the greatest influence over things like gut motility and enzyme secretion. Unfortunately, there's no simple lab that really shows your digestive capacity. Yeah, there are some procedures where you can directly measure, say, acidity in the gut. But there's really no direct measure of pancreatic enzyme output. There's no simple way to get a handle on how much bile that you're making to emulsify fats for digestion. Now, some labs, and I mentioned this in one of our other lessons, some labs that do stool testing give you markers for digestion absorption. The problem is that those markers change from bowel movement to bowel movement. So just a single sample, we can't really rely on that. But when we look back to, okay, what is it that we might have to replace? Well, we have multiple types of digestion. So whether it's protein, fats, or carbohydrates, we'll talk about that in a second. Or we may have to replace something called short-chain fatty acids. Now, short-chain fatty acids, as I'll show you in a moment, are compounds that are made by your probiotics, and they do good things for you. And these are stable. So you can use a stool test with, at least with companies that do this kind of testing, you can use a stool test to get a handle on what your short-chain fatty acid profile is, which is advantageous in some cases. But as I have mentioned before, we don't do stool testing in every single case with every single client. Sometimes it's necessary, sometimes it's a good idea, sometimes we have enough evidence and we agree together that we don't necessarily need the test, but we're going to assume that that is a problem. We're going to proceed as if. So if we don't have any simple lab testing that's easy to do and highly reliable to tell us about what part or what aspect of digestion we might need to replace or support, what do we revert to? Well, sometimes you can get a very good clue of this just based on your symptomatology. And I am not a huge fan of putting together management plans just based on symptoms alone, but there are some circumstances where we have to go with the evidence that's available to us. So for example, if somebody has low hydrochloric acid status, right, stomach acid, this is what's predominantly used to digest proteins. And so someone who has low hydrochloric acid status is going to eat a protein-based meal, and it's just going to sit in their stomach like a brick. It's going to slow things down. And because it's high up in the intestinal system, you're going to get some symptoms pretty quickly after eating, particularly after eating high protein or dense protein meals. So people with HCl issues either avoid eating meats altogether. Sometimes they shift from heavier proteins like pork and veal and beef, and they shift towards eating like chicken and fish. Sometimes they just go completely vegetarian, as I think I have mentioned in other lessons. And there are some specific correlations here. Like it's very common to have low hydrochloric acid status in thyroid conditions, particularly hypothyroidism, but that doesn't necessarily mean that's the only thing that can cause that. So with low hydrochloric acid status, there are symptoms of maldigestion and gut complaints associated with meals that contain a fair amount of protein or certain kinds of proteins. What about pancreatic enzymes? Well, first of all, what are they? These are enzymes made by your pancreas that get dumped into the small intestine that are designed to break down all kinds of macronutrients. So it's protein, fat, and carbohydrates. But typically people with pancreatic enzyme issues really have an issue breaking down fibrous type foods or starchy type foods. They may sometimes find undigested vegetables and fruits in their stools. But as I pointed out before, that the ability of your pancreas to release the enzymes that it has made into the small intestine actually depends upon how much acid is in the stomach, right? We talked before about how the upper part of the small intestine has these acid receptors in it, so that as the acidic residue comes out of the stomach into the small intestine, it triggers the pancreas to release its enzymes to continue to digest all of the different macronutrients. But it seems to be particularly problematic for people who have these low pancreatic enzymes, that fruits and fibers and those kind of things tend to be the most problematic for them. And then finally, how do we decide whether or not we need to support somebody's gallbladder? Well, if someone has low bile production, then typically they're going to either have a lot of complaints eating fried and fatty foods, or they're going to stay away from them altogether. They may say, hey doc, I hope you're not going to give me any fish oils, because when I take them, they just burp on me all the time. And obviously people who have gallbladder problems, people who have had their gallbladder removed are particularly challenged in this area. And there is kind of a common demographic. Certainly anybody can have a gallbladder problem, but it seems to be that middle-aged women, particularly if they carry a little bit of extra body fat and they're still in their reproductive years and have their cycle, tend to have some issues with gallbladder function. That's probably the most common demographic profile where we see these gallbladder issues. So in the absence of really specific and reliable testing, we go back to your symptom picture, and it may be that your digestion is completely fine, and we may have to pick out one or maybe two of these systems to support, or it may be wise in some cases just to kind of do a global approach, right? There are many enzyme formulas that we use that actually support every aspect, right? It supports fat, protein, as well as carbohydrate digestion. And again, the decision of that is based on what we see in your symptoms and the results of any testing that we might have that will give us some clarity on actually what to do with you. Now, the other thing in terms of digestion and enzyme secretion is to go back and just reiterate the fact that there are some common metabolic issues that decrease enzyme capacity, right? We already mentioned the thyroid in the brain. So the thyroid has significant influence over gut motility, over enzyme secretion, as we have reviewed in other lessons. The brain is the same thing. And so whether or not you have, maybe you've got some developmental issues, or let me say it this way. There has never been a child that I or any of my clinician friends and colleagues have worked with who has developmental issues, whether it's pervasive developmental delay, the autism spectrum, attention deficit. There's not a single kid we've worked with that didn't have some kind of a GI problem, right? And that kind of goes hand in hand, and it's as a result of the relationship between the brain and the gut. So we can see enzyme issues with developmental issues. We can also see them in older populations with neurodegeneration. So people who have dementia, Parkinson's and Alzheimer's invariably have bad guts, and that can compromise enzyme secretion. And we may see it with injury, trauma, concussion, traumatic brain injury, that kind of stuff. And I would even go so far as to say is that somebody can have maybe a PTSD type condition or OCD where the brain hasn't necessarily been concussed. The brain hasn't necessarily started to degenerate to any appreciable extent, or maybe they were not a child that had a developmental issue, but somewhere along the way they had some kind of an event that turned on a PTSD state or something similar to that. Well, when the brain gets dysregulated rather than actually diseased or pathological, it can affect the enzyme secretion as well. So brain health just really is a general term. And then another very common one would be blood sugar issues. Anytime that we have poor fuel status, it can affect global function, particularly affect the brain. But we quite often see people with digestion issues that have blood sugar abnormalities as well. And that would include low blood sugar states as well as high blood sugar states. Now, that doesn't mean reading this or listening to this that these are what you have or what your cause and issue is. These are just some of the more common things that we see. Now, what about replacing the other element, which is what we call short-chain fatty acids? We just talked about digestion capacity, but what are short-chain fatty acids? Well, there are different kinds, and the name is actually descriptive. Fatty acids are molecules that are fat-based, and you have short, medium, and long chains, and that just really describes how many molecules are attached together to create a larger structure. So short-chain fatty acids have fewer things that are strung together. And there are several different kinds. There's propionate and acetate and valerate, and there's butyrate. And butyrate is actually the predominant form, and it's the most abundant short-chain fatty acid and the one that we're most typically concerned with it being deficient. And these short-chain fatty acids are actually made by probiotics as they feed off fibers that are in your diet. And so for you to have good butyrate and a good short-chain fatty acid profile, we need to make sure that you've got good probiotic abundance and diversity. I mean, you need to have a lot of good, healthy bacteria, and you need to have multiple species. And the primary function of these short-chain fatty acids, including your butyrate, is to act as a fuel source for the cells of your colon and your large intestine. And that term there, colonocytes, really refers to the cells towards the end of the GI system. But it goes beyond that, and then there actually are other things that we won't go into here. But the primary things that butyrate and other short-chain fatty acids do for us is provide fuel for the intestinal cells to stay healthy and active. But these compounds also protect the colon from inflammation and even from cancer. So we have all kinds of research that says people with, say, inflammatory bowel disorders, ulcerative colitis, Crohn's disease, or other non-autoimmune inflammatory conditions in the gut tend to have really low butyrate. And when we replace butyrate, either from a supplemental form or by restoring the gut flora and feeding them all kinds of fibers, and those butyrate levels go up, then the inflammation goes down. And one of the risks of being chronically inflamed in your intestines is that you can develop intestinal cancer as that inflammation over time dysregulates cell division and cell function. Right? There's no guarantee that someone's gut inflammation is going to have gut cancer or intestinal cancer, but there is an association there. Nevertheless, in order to have a healthy gut, you have to have good butyrate function. You have to have good short-chain fatty acids. Now, there are a couple of circumstances where we will predictably see poor short-chain fatty acids. Remember, stool testing that does look at this really is accurate, because from bowel movement to bowel movement, these things are predictable and they're measurable. But people who have low fiber diets or who have otherwise compromised their gut ecology and their probiotic balance is really low, typically are going to have low short chain fatty acid production because they don't have the elements there that make it. Remember, we make it by having good probiotic balance, lots of numbers, multiple species, and we're feeding them the food, the fibers that keep them fat and happy. And unfortunately, the standard American diet is woefully deficient in these healthy fiber forms. But going back to what we said about SIBO earlier, small intestinal bacterial overgrowth, as out of necessity to manage a SIBO environment, we'll get into details when we do the SIBO lesson, if that's appropriate for you, we have to actually go on a low fiber diet because the fibers in your diet can actually feed the infection. And so if we're not going to feed you fibers to get the short chain fatty acid production from your probiotics, we actually have to give you the short chain fatty acids directly. So there's many different reasons why we might want to replace the short chain fatty acids. And again, sometimes we have lab testing to say, yes, this is needed. Sometimes we just have to make a good educated clinical guess or assumption and say it's smart for us to do this, at least for the short term. Now, what about replenish? Replenish refers to restoring your probiotic environment, right? What are the general functions of probiotics? Well, honestly, too numerable to mention, and this is an area where research is really kind of exploding over the last several years. But in general, probiotics function as part of your immune system. They actually discourage infections. They help you to metabolize carbohydrates and fibers and other things. They're involved in vitamin synthesis. And over the last several years, we've learned that they're involved in some crazy stuff. Like, for example, your probiotic environment can dictate how many calories you extract from your food and may either prevent or promote obesity. There are actually studies published where it kind of sounds a little strange, but they take lab animals and they feed one to make them really fat, and they take a stool sample from a fat animal like a mouse or a rat, and they inject that stool sample into the colon of a skinny mouse, and without changing the diet, the skinny mouse gets obese. And they do it in the opposite direction. They take a stool sample from a skinny mouse and inject it into a fat one, and the skinny mouse, without changing the diet, can actually get lean again. So there's all this kind of crazy stuff that's showing up. It's calorie extraction from diet, it's tendency towards obesity or leanness. We know that certain probiotics make certain compounds that affect different parts of the brain, so we know it's part of brain health. And, I have what else with a question mark there, because we don't know what we're going to learn about the probiotic environment in the next several years. One of the things that we do know about the probiotic environment is that we don't know enough. It is a vastly complex world, and in fact, just to kind of tell you some statistics here, there are about 100 trillion bacteria in a healthy gut. And that's about 10 times more than all of the cells in the human body, right? So you actually have more, under normal circumstances, you have more healthy bacteria in your gut than you have cells in your entire body. And as of right now, there's an estimate about 100 different species of bacteria that live in your gut. And so again, it's a very complex environment. So we know very little about that, but some of the things that we can observe clinically after having worked with people over the years and used probiotics in practice, some people tolerate probiotics early on in the 4R protocol, some do not. And so we don't want to have a standpoint of probiotics are always helpful. And certainly there's many different choices in probiotic formulas to use. But some people, we can start probiotics right away. Some people need some kind of an introduction strategy. And in some cases, for example, like with SIBO or other kinds of infections, we may have to avoid probiotics for a time and then introduce them sequentially with very simple formulas with low doses and only a couple of varieties of different species. And then over time, build them up to higher doses and a broader spectrum formula that contains multiple different kinds. I think as a general rule, at the end of the process or wherever it happens, from a probiotic therapy standpoint, we should be dealing in high numbers and multiple species, but we can't assume that everyone can handle that from the get-go. Now, to kind of paint the spectrum for you, There are people who, again, do tolerate high numbers and multiple species right away, and that's an important part of getting them to progress along that 8 to 16 week protocol that we typically use. But for some people, again, we have to start sometimes doing nothing or sometimes just very, very gently and lightly adding probiotics and then accelerating those efforts over time as we see that the tolerance for that or the system's ability to handle that starts to improve. The final R in the 4R protocol is about repairing the gut. Now, leaky gut is very common, but it's not guaranteed. I have, over the years, just kind of a general assumption that most of my clients have leaky gut just simply because we deal with the metabolic issues that tend to promote leaky gut, but it's not guaranteed, right? So every once in a while we get a normal test coming back. Common causes, we've reviewed some of these in other lessons: chronic stress, inflammation, certain medications, toxins, gut infections, food triggers, hormonal imbalances. Your brain, your thyroid have a lot to do with these things. But healing leaky gut can be a complex issue. It's just like everything else that we deal with, right? We have some people with leaky gut that it's done in 2 months. Others might take 8 to 10. The average is going to be about 4 to 6 months. And actually that period of time initially came to us from some of the top immunologists in the world that were doing research into leaky gut. And then as we compared what they were telling us in the research and in personal conversations to what we were seeing in clinical practice, the two lined up quite well. And so my expectation is that, for example, it takes us anywhere from 8 to 16 weeks to kill critters. It takes anywhere from 4 to 6 months to heal a leaky gut. But it involves multiple things. Like, you can't just take a supplement and assume that you're going to heal the leaky gut. Now, there are supplements that are required. But if you are not finding and removing food triggers like food sensitivities, if you're not killing the critters that are there, if you're not providing those healing nutrients or addressing other metabolic factors like thyroid, brain, blood sugar, adrenals, etc., then you're not going to heal the leaky gut, right? It's a multifactorial or multivariable process. Now, how do we put it all together? Well, everyone's 4R protocol is just a little bit different. We do have some clients that their 4R protocol looks exactly the same, just simply because that's the way that we have to manage each of those person's protocol, and they just coincide. But for one person like you or someone else, we may need to place more emphasis on one element versus another. Somebody might need a little bit more emphasis on the remove and not so much on the enzymes, so to speak. Or we may have to do things for different periods of time. We may completely resolve somebody's gut problem in 3 months, and somebody else it might take 5 or 6 or 8, depending on who they are and what we're dealing with. But again, the general expectation, 8 to 10 to 12 to 16 weeks to kill the critters, minimum of 4 months to heal a leaky gut. Leaky gut may recur easily with some people. And it's going to occur more easily with people who maybe don't completely resolve or deal with the other metabolic issues that perhaps created the leaky gut to begin with. And also clients with autoimmune gut problems are going to have a harder time simply because they have a chronic problem or metabolic issue and challenge that tends to promote breaking down of the gut environment. So that's it. Pretty quick and simple today, just because it's a general framework and all of the details come from your one-on-one sessions and looking at the other data. So just keep that in mind. Remove, replace, replenish, repair, and we need to make sure that we're putting it together in a way that makes sense for you and your situation. We'll talk to you again real soon.